Go ahead, ma'am.
Good afternoon, everyone. This is Dr. Poornima Mathur from Oasis Fertility. So today we are going to discuss about preconceptional counseling. So आज तक हमारा क्वेश्चन ये था कि if I'm not conceived after active trying for 1 year, what do I do next? But we are shifting the question a little bit. Now the question to you is: Are you planning for pregnancy in the coming 1 year? If yes, preconceptional counseling is for you. Now I know this preconceptional counseling हमें लगता है this is not the trend. हर किसी को natural pregnancy हो जाती है, तो why do we need to go and see a doctor? What is the use and how is it going to help me out? So preconceptional counseling जो है that is basically जब आप pregnancy के लिए try करने वाले हो, we need to हमें आपकी health को optimize करने की ज़रूरत है. कोई risk factors हैं तो हमें उनको correct करने की ज़रूरत है. We need to counsel you so that we can help you achieve a natural pregnancy and a healthy pregnancy. That is more important. So, who should get it? Like, who is eligible for a preconception counseling? Who should go? When should they go? And where do we go? So, it's like any couple, I mean the heterosexual couple or a lesbian couples, gay, LGBTQ community, anybody who is thinking of starting their family in the coming 1 year, आपको अपने रिप्रोडक्टिव स्पेशलिस्ट और देयर नियरेस्ट गायनेक और ऑब्स्टेट्रिशियन उनके पास जाके मिलके यू शुड डिस्कस आउट थिंग्स कि वी आर प्लानिंग अ प्रेगनेंसी इन द कमिंग 1 year. So, and I want to have a preconceptional counseling. Now, the next question is like, what do I expect out of a preconceptional counseling? What do I expect कि मेरा क्या evaluation होना है and what should I give? So now, when you come for a preconceptional counseling, the most important thing is having a history, a very thorough history. कि आपको कोई current कोई problem है? Are we dealing with any medical disorder? Is there any medical disorder running in our family? Is there any genetic disorder running in our family? क्या हमें कोई जेनेटिक कंडीशन है जो हमारी फैमिली में इनहेरिट हो रही है और या हम कोई मेडिकेशंस के ऊपर ऑलरेडी है. नाउ व्हाई इज इट इम्पोर्टेंट? नाउ इट इज इम्पोर्टेंट सो दैट हम आपकी हेल्थ ऑप्टिमाइज कर सके. वन यू आर इन योर हेल्दी फ्रेम, आपकी हेल्थ ऑप्टिमाइज है, दैट इज व्हेन योर चांसेस ऑफ कंसीविंग and more so your chances of carrying out your pregnancy for 9 months in a healthy version and having a healthy baby as the end result are significantly increased. So now what are the conditions that we're talking about? अगर हम hypertension की कोई medicine लेते हैं, अगर हमारा BP high होता है, we are taking certain medicines. So not every medicine is safe to have during pregnancy. So कुछ medicines ऐसी हैं कि अगर आप उन medicines के ऊपर हो, जैसे हमारी ACE inhibitors हैं, and आप conceive करते हो उनके ऊपर, तो that can have a significant malformations in the baby. So अगर हम pregnancy के लिए plan कर रहे हैं, तो your gynecologist in conjunction with your medical specialist will change your medicines so that their pregnancy is safe. At the same time, your hypertension is also very well under control. Now, if in case we have diabetes, जिसके लिए हम medicines ले रहे हैं, so we need to optimize your sugar controls. Your HbA1c needs to be under check because high sugar levels, high HbA1c levels can again lead to malformations in the baby. There are certain drugs which need to be changed so that we have an optimal sugar control. अगर हमें कोई thrombophilias है, family history है thrombophilias की, if there is thyroid disorders, so we need to optimize those medical conditions so that we have a higher chance of having a pregnancy and a healthy pregnancy. Now, this is about your personal medical history. Now comes the family history. Now, for instance, you have a very strong family history of certain genetic disorders. कि भाई हमारे first cousin में ये medical problem है, or there is some thalassemia running in our family, or there is certain medical conditions like हमारे spinal muscular dystrophy है, or some X-linked recessive disorders है, hemophilias है, which are in your family. Now, if in case हमारी कोई भी medical history है जो significant है genetic, we can have a detailed genetic counseling along with your gynec and a genetic counselor who can help us understand how are these uh, diseases inherited, what is your lineage, how much at risk हम हैं कि हमें ये medical condition हो सकती है, we can transmit it to the offspring, and how can we prevent it. What are the measures जो हम ले सकते हैं so that हम ये genetic disorder हमारी subsequent future progeny में ये translate ना करें. The next most important thing is optimizing our health. Now at times हमारा weight, the BMI जो हम लेते हैं, the body mass index. So now a part of preconceptional counseling is optimizing your weight. So it does not mean कि you will be given कि जाओ जाके weight loss करो. It's like when you go and meet with your doctor is going to evaluate you कि भी हमारा what are the causes that is leading to this unnecessary weight gain or which is preventing you from losing weight. What are the implications जो हमारा weight gain हुआ है, is that leading to insulin resistance in our body, is that leading to a lipid metabolic disorders in our body. So whatever medical, the impact of obesity on our body, that needs to be catered. The obesity हमारा जो weight reduction, that needs to be taken care of. So that would include a thorough evaluation and a multidisciplinary approach कि आपके dietitian, your gynec, and we have somebody who can help us out with the physical activity part. We work in conjunction so that we can have a desired weight. If we are in a proper weight range, हमारा अगर BMI normal है, तो that significantly improves हमारे chances of achieving pregnancy, and it significantly reduces हमारी the number of complications that are associated with obesity during pregnancy. Hence, ensures a healthy pregnancy. Now, apart from that, what is important is कि हमारा sexually transmitted infections की screening. Now, at times we frequently have vaginal discharges, multiple partners कभी होते हैं, or we do not pay heed to a little bit of yeah, okay, fine, discharges are common, or there is some lesion. So now, depending upon your history and your local examination, you will be screened for sexually transmitted infections, whether or not we need any treatment for the same. If there is any sexually transmitted infection detected, उसके लिए adequate treatment लेके we can actually start with the planning of the pregnancy. Okay, 1 year down the line, whenever you want to plan pregnancy, you are treated for it and you are at a safer side. Now, the another important component is the vaccinations. Now, when I talk about vaccinations, is there are certain infections now which जिनके against हमें vaccines वो होती है. Now, we in the era of COVID, we've all known the importance and significance of vaccines. So, apart from COVID, there are many other viral infections जिनके against vaccines है. And these infections, when happen during pregnancy, वो pregnancy के ऊपर significant impact कर सकते हैं. Now, the first is the rubella vaccine. Now, rubella is a very common flu-like illness, very commonly seen in India. And अगर आप देखोगे तो it is included in our Indian Academy of Association of Pediatrics के vaccination schedule में and the government schedule में. Now, every baby is offered a vaccination against rubella at 9 months of age. But that was not so in the early 90s or before that. So when we are not immunized to rubella, now it is very you can be exposed to rubella during your early pregnancy months. Now, अगर हमें ये rubella infection during our early pregnancy होता है, तो we are at a higher risk कि baby के अंदर genetic malformations जैसे हमारा sensory neural hearing loss, which cannot be picked up by an ultrasound. So it can lead to anomalies in the baby. So it is strongly recommended कि आप rubella के against अपना immunization वो आप पहले ब्लड टेस्ट से डिटेक्ट करवाओ. इफ यू आर नॉट वैक्सीनेटेड अगेंस्ट रूबेला, get your vaccine done, and once you have that vaccine, after 4 weeks you can go ahead and plan for pregnancy. So rubella vaccination is another important thing. उसके अलावा we have vaccination against hepatitis B according to wherever you are, which country you are, like the seasonal flu vaccines, the other infections that if you are traveling, if you're frequently traveling, if you're traveling overseas, कि हमें Middle East में यहाँ जाना होता है, या these are the African countries that we're traveling. So you should have a like, okay, fine, this is my work profile. I travel to these places, so these are the vaccines that I need to take. So in vaccines के इतने months या इतने weeks के बाद I can plan for pregnancy. So you have a plan in your place. So when we are talking about the work, there's another important thing is your work exposure. Now, some people have a sedentary lifestyle where they're working in front of desk, but some people they go to factories where उनको exposure होता है, exposure to certain chemicals, exposure to radiations, drugs. So now we need to actually discuss that कि अगर हम consider कर रहे हैं planning for pregnancy, we're planning pregnancies in another 1 year, so we need to see कि हमारे occupational exposure किस किस चीज़ का है and what kind of impact do they have on the pregnancy or our ability to conceive. If there's somebody who's working in a chemical industry who's exposed to constant fumes of chemicals like benzyl peroxide or hydrochloric acid or any fertilizer plant, for instance. So now that person, say for instance it's a male, he would be exposed to these chemicals which can have a very deleterious impact. मतलब उनकी जो semen quality है उसके ऊपर काफी significantly impact हो सकता है. So now if we are planning for pregnancy, we know we might have some troubles with conception अगर हमारे semen parameters altered है. So we can try to curtail those exposures, or we can get an initial evaluation done so that we know ki what are we dealing with and whether or not we need an assistance for the same. Similarly we need to know कि fine हमारा अगर हम high temperatures पे हमारा exposure है, so that high temperatures can further impact हमारे semen parameters or our health, and which can impact our fertility parameters. Now the another thing is कि हमें ये देखने के important है कि what is the family history regarding premature ovarian insufficiency. Now this is very important because earlier the incidence of low ovarian reserve or premature ovarian insufficiency was very low. So if you go back home and ask your parents, like mother से अपने पूछो कि mom at what time did you hit your menopause? Now if your mother says कि any time before 40, कि मुझे 38 में menopause आ गया. Now if we talk about that generation, our parents were very wise. They had their pregnancies before the 30, and in late 30s they were all done with the gynec issues. So if they had, they would not significantly mention it to you. Ki, bhai, I had my menopause at 37 to 38. For them, it was pretty late. But in today's era, if we have to go by technical scientific terms, anything less than 40 is premature menopause, which needs evaluation and treatment. So if we have a family history कि हमारी mother में history थी around 37, 38, there was an early menopause or ovarian failure. So we know that we might be at risk for a premature ovarian insufficiency, and that would mandate that you get yourself evaluated whether what is your egg reserves and how long can you actually postpone your pregnancy, or how sooner should you plan it out. So these are the things which are actually going to are actually evaluated during a preconception counseling. So when you come to the doctor for a preconception counseling, तो उसमें हम क्या expect करेंगे? Now the first thing is, the first and foremost part of any medical evaluation is a detailed history. So when you go meet your doctor, the first thing would be a detailed history regarding आपकी health, आपकी cycles. Now why are they important? Now if there is somebody who's having constant irregular cycles, so we know that since the cycles are irregular, we might have some difficulty trying to conceive naturally. So the causes of irregular cycles can be n number of causes. It can be something as PCOS, some thyroid problems, hyperprolactinemia, obesity, any other hormonal ovulatory dysfunction that is happening, or any medicines or supplements that we are taking. So your doctor would evaluate what is the cause of your irregular cycles. Now necessary treatment would be given so that we can regularize their cycle, and it can help you conceive. Now if in case we have some problems with that, you would know कि भाई अगर if I have my irregular cycles which despite of treatment is not getting fixed, so we know that we might need intervention with the help of the fertility specialist जो हमें थोड़ी सी medicines देके help कर सकता है. That would that would avoid the unnecessary stress that you would have कि हमें cycle से irregular है, we are still trying for another year, and when we are like disappointed, it's not working out. Jabki if you go to the doctor, they find out the cause, they treat it, and you get help conceiving. So apart from your menstrual cycle, your sexual history, like how often do you have a relationship, if there's any coital difficulties, anything suggestive of premature ejaculation or anything, so they can help you with that, and then you can plan your pregnancy accordingly. Your medical history would be taken in detail, and your family's history. Now whether anybody, if there is a very strong family history of diabetes or dyslipidemia, we know that we are at risk for it, and we need to get it evaluated so that we can fix our insulin resistance or dyslipidemia if there is any. Now, and the most important one is the genetic history, the history of any genetic abnormality or autistic order syndromes or any problem in the history which can be pinpointed to a particular genetic cause, and it can be dealt with accordingly. Now, apart from a detailed history, there would come an examination, the physical examination of the female. That would include a local gynec examination to rule out any abnormalities, plus and transvaginal ultrasound. Now, the ultrasound can be a transabdominal or a transvaginal. The most preferred one is a transvaginal ultrasound, which gives us a detailed analysis of the uterus, the ovaries, the reserves of the ovary. So now, when we go ahead with an initial screening ultrasound, that would tell me how good is the uterus. If there is any problem which needs correction, there's any structural abnormality, any polyp, anything that would necessitate treatment before you can get pregnant. So that can be corrected initially. Apart from the local examination, there would be a general examination also regarding your blood pressure, your weight, your BMI, so that things can be fixed accordingly. Now, similarly, the preconception counseling is definitely not limited to the female only. It is extends to the male partner as well, or your partner, however you are planning to conceive. So now your male partner would be have a detailed history evaluation so that we know if there's any risk factor that we are missing. Apart from that, that would be a basic semen analysis, which tells me now if there is history suggestive of chemical exposure or history of there'll be overweight or some medical comorbidity, which we know can impact the seminal parameters. We go ahead with a simple semen analysis, which can give us a detailed information regarding what is the reproductive potential, is there any problem that needs to be corrected, or does it need any further evaluation. So apart from that, obviously, if we have the LGBTQ community who are planning to plan for pregnancy, the doctor can actually suggest you different ways how we can actually achieve our goal of pregnancy with or without assistance, so that we can help you out realize your goal of parenthood. Now, apart from that, there is the most important thing is after the examination and everything is evaluated, the doctor would give you an advice regarding what are the supplements that we need to take. Are we lacking on any vaccination schedule we need to catch up on? What should be the dietary changes that we need to make in order to optimize or maximize our chances of achieving our pregnancy? And what are the pre-pregnancy supplements that we are needed to take, and any changes in the medicines that need to be made? So now the foremost important thing is if you are planning for pregnancy, a simple folic acid supplementation can significantly reduce your neural tube defects. So a folic acid supplementation is very important. Depending upon if somebody who's low on hemoglobin who is anemic, iron supplementation to maintain the hemodynamic state, the blood status, vitamin D supplementation, somebody who's low on vitamin D levels, B12 supplementations, all the necessary vitamins are to be administered so that we achieve a very healthy state. Diet which can help you improve your chances of pregnancy, having a fiber rich diet, having antioxidant rich diet, more on leafy vegetables that can optimize your health and help us achieve pregnancy is suggested. Depending upon your BMI, weight reduction chart can be made. You like how do we work on it? You sit down, work out a plan with your doctor. How do we tend to achieve? What is our target weight? How much are we planning to reduce in how many duration, how many months, and how do we go ahead further with it? So that is to be done. Next, the vaccination. If we are low, if we are planning for a pregnancy in 1 year, we get our rubella vaccination checked. We see whether we are vaccinated against HPV or not. Any seasonal flu vaccines, so hepatitis B vaccination. So the vaccinations that are lagging, the doctor would actually guide you regarding when to take it and when to plan your pregnancy after the vaccination. So once the vaccination is taken care of, if we have any medical disorder, the medicines are altered according to their pregnancy safety margin. Now, certain antihepatitis would be changed to a more acceptable pregnancy safe medication. Your thyroid levels would be managed. Now, once we have made the necessary changes in conjunction with your physician, you know that you are taking drugs that are absolutely safe. You can go safe for pregnancy. You can go ahead and plan your pregnancy after your drugs have been changed and your hormones have been optimized about it. So, if there is any chances of pre-gestational diabetes, they need to be worked out. If we have a strong history of thrombophilias in our family, they would be changed. You would be started on certain medicines before you plan for your pregnancy, and things would be sorted out according to it. So, these are the things that happen during a preconceptional counseling. Now, if we go ahead, we know that most of the pregnancies in a era where we are talking about IVF, we're talking about all the assisted reproductive techniques. We should not forget that natural pregnancy is the major bulk of pregnancies that people achieve. Now, our main aim is at Oasis Fertility is help people get pregnant and help people deliver a healthy baby at the end of the 9 months. So when we are looking forward to getting you pregnant, we have to take into my consideration that natural pregnancies are a major bulk. So we would like to help you achieve your natural pregnancy as well. So when you come to Oasis for your preconception counseling, you can get evaluated. We can help you and guide you how to go ahead and plan your pregnancies so that you can achieve your dream of parenthood with the minimum hassles and the maximum joy. Thank you so much. Any questions? Preconception time period. So it is said at least 3 months before you get pregnant, you plan for pregnancy, you should go ahead, see a doctor, and get your prenup supplements taken. But advisable is if you're looking forward to pregnancy in a year, you have it sorted out in next year, I want to get pregnant, better get yourself evaluated, more so if you already have an existing medical disorders. The aim of preconception, we've discussed the entire thing about the preconception. The aim of preconception is basically to optimize your health and to make sure that there is minimal risk to the mother and the baby during the pregnancy and to ensure a live, healthy pregnancy outcome. So that's all for today. If you have any queries, please feel free to contact the Oasis Fertility helpline. We at Oasis Fertility are there to help you out in every walk to help you achieve your pregnancy, whether it's natural with IUI or with IVF. Thank you so much.